Hi, I'm Dr. Marino Kambourakis, and I'm a chiropractor here at Prestige Health and Wellness FiDi location. Actually, what inspired me to become a chiropractor was my grandfather. My grandfather was my best friend, and he fell down a flight of stairs, and he needed surgery. He needed to see a lot of doctors. He needed to see a lot of physical therapists and chiropractors. I was pre-med at the time at SJU. He sat me down one day when we were having coffee, and he turned to me and he was like, "You have too much personality to be a regular medical doctor." And I thought that was really funny. He was like, "You're not the type of guy to write a script and just hand it to somebody. You have too much anxiety. You want them feeling better the minute that they see you." And I totally agreed with him. And he said, "You know, I could see you being a chiropractor," and that resonated with me. And I was young. I was in my first year of pre-med at St. John's, and when it came down to it, to pick a school, to pick a trade, to pick a specialty, I was leaning towards physical therapy and chiropractic, honestly. And then I really looked into it and I chose chiropractic. What I love most about practicing is helping people who ultimately feel helpless. You know, they're dealing with pain, they're dealing with all these issues. And I like seeing the aha moment and their eyes light up when they actually realize what's going on and realize that we can help. And genuinely, I just love people. And I love hearing everybody's stories and meeting new people. I love sports in general. And I loved the fact that every football team has a chiropractor. I love that golfers reach out to chiropractors and even get adjusted on the green. So I really love that aspect of it. But I was always interested in biomechanics in general. One thing that I want patients to understand about what I do is that chiropractors don't only adjust the spine. We love to work with extremities. I personally absolutely love to work with people's extremities, shoulders, knees, ankles. I want patients to feel completely at home when they meet me. I treat everybody like they're my brother or my sister. I like to have a lot of fun in the room and talk more about their day-to-day stuff. I want everyone to be really comfortable when they're in the room with me. I sit and I listen to them, and then when I figure out who they are, I can best tailor a treatment around them. I think that it's super important that as a clinician, you treat every patient as a human being and not just as a random patient. What motivates me is honestly people coming in specifically to see me. When people rely on me for help, I take it very seriously. I treat everybody like they're my family. So in the back of my head, I'm like, oh, I can't take off today because so-and-so needs me to do this and she has a really big weekend. So I genuinely care for my patients, and I make them a part of my life just as much as they make me a part of theirs.